start. Then we move to the slides. And now we start with the first slide. As you see, today we continue speaking about lifestyle, and this is our second class on the same unit. Well, I am waiting for the slide. So, do you see it full screen?
No.
So let's try one more time. Mhm. What about now? Is it full screen now?
Yes, ma'am.
Okay. So first, let us start with the language for physical exercise. So here we can see some the verbs and a couple of noun phrases. And our task is to match each verb with the best noun phrase to create general advice for exercise. So, for example, one of the verbs is kick. The meaning of kick is give up here in this context. So, what about the first verb, take up? What is the best phrase about exercising? Take up what?
Some physical activity.
Exactly. Okay. Then there is kick.
Old habit.
Yes.
Old habits.
Kick old habits, right? Then the same task, we have a couple of new words, just the words we should remember. Regime as a plan and settle into, get used to something. So the same task, stick to
A new regime.
A new regime.
a new regime. Settle into
New routine.
A new routine.
okay.
New routine.
Yes, and here increase. Increase what?
Amount of exercise.
Amount
of
Gradually. Yes, gradually. It's important. And make.
Minor changes.
Exactly. And devise. Devise here means to produce, to create. Devise.
Your own exercise program.
Good. These are the useful phrases when we speak about physical activity, when we can advise our patient to start doing some physical exercises. And so let us just look at this slide. Here's the exercise where we need to add the phrases to the sentences. So these phrases which we have just read, settle into a new routine, stick to a new regime, increase the amount of exercise you do gradually, kick all habits, take up some physical activity, devise your own exercise program, and make minor changes. So we have a look at the first sentence. What is the best phrase to be used here? Once you'll begin to notice some improvement. So what is the best phrase here?
Settle into a new routine.
Okay, settle into in your routine. Are there other the phrases also possible to be used?
Make minor changes.
Okay, yes.
Kick old habits. Take up some physical activity.
Yes, actually, all of them are possible to use here. I would like you to think about the other sentences and so write them and try to use one of the phrases which are given above only once. If we agree that stick to a new, settle into a new, yes, what is settle? Settle into a new routine is the best phrase here. So distribute the other phrases among the other sentences here. I'll give you 3 minutes to write them and do it individually, please. Okay? Start, please. Well, are you done? Have you written the sentences? Okay. Anyway, it's time to check them as Asna. So, what is the best phrase in the second sentence? Read, please.
If you settle into new routine and set yourself achievable aims, you will be more likely to succeed.
Mhm. So, good. What about the other students? Which version, which option do you suggest to use here?
Kick old habits.
Kick old habits.
Okay, also possible. Mhm. So, good. Yes. Mhm. Okay, the next is for Shamisha. Number 3, please.
Hello, ma'am.
Yes, we can hear you, Shamisha.
Which question, ma'am? I lost my network connection.
Now, can you read sentence number 3?
Okay, ma'am. It is difficult to dash, but once you have got into, I think, kick old habits.
Yes, it's one of the most difficult things. So what about the other students? What is your option here?
Stick to a new Russian.
Mhm. Okay, it's also difficult. Good. So then, Ramisha, are you
Yes,
here?
ma'am.
Number 4, please.
Yes, ma'am. Have you thought of getting someone to help you to settle into a new routine?
Mhm. Mhm. Help you settle into a new routine. Okay. What else is possible to use here?
Devise your own exercise program.
Yes. So yes, we need help in this situation, right? Well, then let us listen to John Farvin.
Start small and then try to increase the amount of exercise you do gradually.
Yes, this is, I think, the best option here in this case, in this sentence. Okay, Hala Malik, please.
It's better dash that fit into your daily routine. Take up some physical activities.
Mhm, mhm. Okay,
Better physical
yes,
activities.
good. And the last one, number 7, let us listen to Sultan.
Yes, ma'am.
Mhm.
Dash is not easy, but it is not impossible to break them. Kick old habits is not easy.
Okay, so if we use this
Make
phrase here in this sentence, it's better to use a gerund ing form. So it's like kicking old habits is not easy, right? But it's not impossible to break them. Yes, and this is the only possible just phrase which can be used in this sentence, because we have in the second part of the sentence there is them. This is about something in plural form. So we can break only old habits here. Okay, so these are the useful ideas. And so there are more useful ideas. So let us introduce more specific examples for physical activities. So there is a list of them, like light and strenuous walking, swimming, a brisk walk, visit a gym, cycling, getting off the bus 1 or 2 stops earlier, running, etc. And if, as a doctor, you would like to just offer some ideas about physical activity to your patient, so start please with these phrases: you can, or you could, or for example, if. So please, your ideas, what kind of physical activities can you recommend to a patient? Yes? You can walk, right?
Yes.
You
You
can,
can visit a gym regularly.
Mhm.
Cycling.
You can start cycling. Mhm.
You could have a brisk walk daily.
Yes, okay.
If you could swim, it will increase your blood circulation.
For example, if you could get if you can get off the bus 1 or 2 stops earlier.
If the person uses a bus just to get to work. Okay. Yes, this is the ideas, the form. You can suggest various ideas to your patients. Okay, and if we move to the next slide, here we can see so some information about stress. So increasing stress is a feature of society as a whole. And general practitioners scored twice the national average on stress test scores. So the work of general practitioners is very stressful. What do you think are the three main causes of stress forced by doctors in general practice? The three main causes, what are they?
Work,
Mhm.
poor health of the doctor.
Okay, what else? Mhm. So, general,
Regular time, maybe work schedules.
sorry, will you repeat please?
Difficult to patients may have different patients have, each patient will be different, and their characters or talking, the method of communication will be different, so it will be very difficult for the doctor to communicate with the patients.
Mhm. So there can be some difficult patients, right? Mhm. Okay. So we are speaking only about so communicating to patients, to people. Are there any other causes of stress? Any other problems? Mhm.
They may feel administration problem, the problem with administration, that the one doctor may have more patients, or the time of shift, the time of working, the doctor may have problem in that also. Due to
Administrative just schedule and issue. Mhm.
the call time may be very early, or sometimes the call time will be very late. So the doctor may face the problem of traveling or family issues or something.
Exactly. Okay. Any more ideas?
Maybe the patients, they may not understand what the doctor is saying and they may argue back. This can also create stress in doctors.
Okay, good. And so you've named some of the causes of stress, and state one main effect of stress on a doctor's clinical work, the general practice, and home life. What is the effect of stress? So there's a big workload, some issues with administration, difficult patients. So, and how does so the general practitioner experiences stress, and what are the outcomes? What is the effect of stress?
It may cause anxiety, headache, and such problems.
Sorry?
It
Physical
may
and
lead to
mental.
clinical error, and the prescription may be false.
Yes.
Doctor is exposed to continuous stress, cannot get take a decision quickly. As if the doctor is free in mind, he can take a decision, sudden decision, and that will be correct. But if the doctor is facing high stress, the sudden decision he is taking may not be correct. So it may cause danger to the life of that patient or in his.
Yes, the
And
risk
if
of making
doctors
mistakes is very high. Okay, yes.
and if doctor is under stress, he might get angry soon to the patients. So this may also affect the patient's health.
The patients won't trust such a doctor.
Yes, ma'am.
And he can get angry not only to their patients, but also to the members of his family, right?
Yes.
And so they do not feel secure. And so it's also a problem. Any more ideas? No ideas. Okay. So actually, if we move here to the next slide, there is the logo of our organization, which is called BMA. These letters stands for the British Medical Association. So what actions can doctors take to reduce the stress they can face at work? So this, the British Medical Association offers a confidential stress counseling service for members. So just some consultation, how to deal with stress, how to reduce it. And do you know, are there any similar services in your own country? Like the BMA?
Yes, there are, ma'am. In hospitals, I used to conduct occasional meetings with the doctors and also some counseling sessions.
Mhm, mhm. So it means some kind of psychological service in hospitals, right? Which can help the general practitioners and other doctors to deal with stress, right? Mhm. Okay. Let us move to the next slide. And here is the writing task, which we need to do. This is how to help with stress. Imagine the situation that a fellow doctor has mentioned in an email to you that he is stressed in his new general practice in Australia. And he mentions the following factors, like too much work. We were speaking about this, one of the causes of stress. Then rapid changes in technology. This can also cause stress. The fact that he never takes breaks, and he is reluctant to talk to his colleagues and family as he does not want to appear weak. This is the influence of his personality. And our task is to write a reply mentioning one or more of the above factors and describe a real past situation where you faced stress and how you dealt with it. So from your own experience, or it's better, or so from the experience of other people, you should just write an encouraging letter to him. So then mention the problems, describe the problems that he writes about in his email. So is the task clear?
Yes, ma'am.
Okay, so please just 5 minutes to you to write this reply. Start, please. Well, let us listen to the students. So to your replies. So Sinju, will you start, please?
Yes, ma'am. Should I read that what I have written, ma'am?
So yes, read what you've written, please.
Hello, doctor. I can understand your situation, but all this can be changed by approaching it through an open mind and finding solutions to cope up with it. Try to get breaks and relax yourself in between your work schedule. Try talking with your friends. You can get involved in daily physical activities. Try to mingle well with your coworkers. For example, if you can spend time together in gym, or you can take a walk with your friends. You can open up your mind to your close ones. Even I faced such a situation where I was completely stressed, but I changed that stress to the willpower to achieve my goal. That was when I finished my 12th public exam, where I got less marks. And I was the one who got the less marks, but my mom was the one who was blamed for that. In that case, I used entrance exam for the medical course. That was it.
Okay, so very good. So very good, just a piece of advice and very good example from your own experience. Great. So who would like to add some other different ideas that came to your mind? So do you have the same ideas or different? Hello. Danish, are you here?
Same ideas, ma'am.
Same ideas.
Yes, ma'am.
Yes.
Almost same ideas, ma'am.
Mm-hmm.
Like playing games, watching movies, reading books.
Mm-hmm. To relax.
May reduce the stress. Yes.
Mm-hmm. Okay, good. So thank you. And so we should remember about this. And now we are going to listen to some conversation between a doctor and his patient. And the question is, look at the statements. What are the doctor and patient talking about? Look through the sentences which are here on this slide. What will the conversation be about? So do you have any ideas? Is it about hobbies or is it about cycling or what? Yes, Sashwati, what do you think?
Yes, ma'am. Here, the doctor and patient is talking about how to increase the health, like basically the health condition of a normal person by he is talking about diet and avoiding about the junk foods. He's also talking about having exercise.
Okay.
So I think it is all about to increase the health condition, to have a better healthy life.
Yes. Now let us check. We are going to move to the next slide. And here, let us listen and decide, are these statements true or false? I'll start the recording and you'll tell me if you hear or not.
Listening to. It isn't easy to.
Yes, ma'am.
Okay, you can hear.
Yes, ma'am.
Okay, now let's.
Listening to. It isn't easy to lose weight, as there are so many ways to do it that people find it difficult to choose from them. And there are so many temptations as well. Have you tried to diet before?
Yes, but none of them worked.
What did you do?
I've tried various diets like the Atkins diet, and I've bought various commercial diets, but I found I couldn't stick to them.
What do you think the problem is?
I tend to snack a lot during the day with crisps and fizzy drinks and biscuits and sweets. I'm sitting around a lot at work and I've tried to cut out all these things, but it's impossible.
It's difficult to break habits like this, but there are ways around it. Rather than cutting out everything suddenly, it's perhaps better to do it gradually. You could have diet cola instead of the normal cola, or better still, fresh fruit juice, low-fat crisps, and introduce some fruit. The danger is trying to do everything at one time and then giving up. Then, when you get used to it, you can make more changes.
Maybe I could give it a go.
What about exercise?
Well, I spend most of my day at a desk. When I was younger, I used to swim and I did some yoga, but not anymore.
We've all been a bit more active in the past. Have you thought of taking up swimming again?
Yes, but it's time. After work, I'm too tired to do anything, and it's difficult to cut down eating as it makes me irritable.
Okay, now let us comment on the statements and let's listen to Taib. Taib, the first statement, please, is for you.
Yes, ma'am. It's the first sentence is actually it's true because she have tried to take a diet, ma'am.
Yes, different
It's true, ma'am.
diets. It's true. Okay, the second is for Labib.
Yes, ma'am. Second sentence is also true, ma'am. The patient has tried to stop eating crisps and other junk foods in the past. It is true.
Good. Hepzibah.
The doctor suggests a gradual approach. It is true, ma'am.
The next is for Ansila. Ansila.
The doctor, ma'am, can you hear me?
Yes, yes.
The doctor is sympathetic to patient situation. No, he's not sympathetic.
Isn't he sympathetic to the patient's situation? So I think he is sympathetic.
He's asking, right, to do the diet.
Okay, so we'll speak about sympathy a little bit later. Okay, and Asna, the next sentence, please. Asna, hello.
Yes, ma'am. Yes, ma'am.
Number 5.
The patient is ma'am 5. The patient is reluctant to try to approach suggested by doctor. It is false, ma'am.
This is false because she really wants to follow doctor's advice. Okay. So Shanisha, please.
The doctor suggests taking up a yoga as an exercise. He's actually asking about the exercise, so it's true.
And what kind of physical activity does the doctor suggest to the patient? Is it taking up yoga or something else, something different? So they were speaking about yoga, but the patient, she was also speaking about the other physical activity. What was it?
Swimming.
Yes, so and the doctor just suggests taking up swimming. So this sentence is false. Okay, so Ranisha, please.
Yes, ma'am. The patient's excuse is to do with the injury. It is false.
Yes, what's the patient's excuse?
Excuse is time.
Yes, so she's too tired to go swimming. Yes, after work. Okay, yes. Let us stop here because there is only 1 minute left here.